to the dosage forms. As discussed earlier, you can classify and you can talk about this, all the dosage forms which are maximum available to the patients, and then you can have a discussion. Now, shall we start? Shall we start? Okay. You can turn here.
Yeah, I had discussed about doses and there are some include as example.
Okay. Then, in case of dosage forms,
Tablets, capsules, pills.
so you have a tablet, isn't it? Then you have a capsules and then pills. What is the advantage of capsules over tablets? Do you have any idea? Capsule. What is the advantage of capsule over tablets? Just to think, there is a tablet, paracetamol tablet. There is a capsule. What may be the advantage? Bitterness. So, if you are taking a tablet, some bitterness will be there. If you take a gelatin coated capsules, you cannot have the bitterness. So, patient will not have any palatability problems. Okay, right. Next you will be explaining about the bulk dosage forms.
Fine powders.
No, there are types of powders. No, you can start with that.
Fine powders, dusting powders.
Yeah, there are neat dusting powders. Yeah.
Eye drops, granules, identifies snuffs, insufficiencies.
Okay. So can you brief in all those solid dosage forms together? See here, you have solid dosage forms and the bulk, isn't it? You combine it at all the names. Read it.
Fine powders, dusting powders, insufficiencies, identifies snuffs, eye drops, granules.
Very good. Come. Next, we can tell about the biphasic formulations. Liquid dosage form.
Liquid dosage form, bioavailability, emulsion, suspension.
What is emulsion? What is an emulsion? Can you give an example for the emulsion you have prepared in the laboratory? Have you done emulsion? Castor oil emulsion? In Tamil it is called as Parenteral. Castor oil emulsion have you done? Just give the name of emulsion. Suspension. Have you seen some of the suspension as drugs? Have you seen suspension? Have you seen the glycerol bottle? Have you all seen a glycerol bottle? How does this? What is the color of the glycerol bottle? What is the color of the glycerol bottle? Pink color. So what is it? Why that is pink color? Maybe that will be colored, isn't it? So there is suspension. You can give most of the digestive things. You have seen magnesium hydroxide gel, isn't it? Aluminum hydroxide gel that are used as suspensions. Okay. Now you tell me about the various dosages and tell me about the biphasic forms. Read it.
Monophasic, internal and external, internal drops, hinges, external sprays, gargles, liniments, mouthwash, nostril drops, deodorants, eye lotion, lotions.
So you have monophasic. What do you mean by monophasic? Mono means what? Anyone? Mono means single. So it will be in one phase. Everything will be in unique. Biphasic means there will be a liquid and a solid. Biphasic means two phases. One is solid and one is liquid. So in suspension you will have some solid particles which is suspended over the liquid. Am I right? Okay. Now you go and explain next. You go and explain about the semi-solid dosage forms.
Semi-solid dosage form is further classified into internal and external.
Very good.
Internal necessaries and suppositories.
Can you give some of the examples of suppositories? Paracetamol suppository. Have you heard? In case of infants, if a children is getting high temperature, this paracetamol suppository is helpful. When the temperature goes beyond 1 or 2 and it is dangerous or if it is intensive care, they will use a simple technique called as suppositories. It is an external application. It will be mounted through mostly anal canal and then the temperature will be reduced. Next.
External ointment, jellies, pastes, creams.
Ointments. Can you give any ointments? Examples. which are used as protective ointments. Anyone of you? Protective ointments, silver ointments. Have you heard about silver? Silver sulfate. Silver sulfate is one ointment which is used to protect the skin from burns. So what is the thing which is used for burns is silver sulfate. You have commercial available products now in that silver sulfate is used for treating burns. Okay, and you have jellies, pastes, creams. So these creams are used. These are similar properties. Okay, so you just next one. You just tell me about the total pharmaceutical dosage forms.
Pharmaceutical dosage form. Unit
No, first we have to classify on
solid dosage form, liquid dosage form, semi-solid dosage form, unit dosage form, tablets, capsules, pills, bulk dosage,
Yeah.
fine powder, glycerin powder, eye drops, granule, terrified,
Very good.
biphasic and monophasic.
Yeah. In the biphasic you have two. What are the two?
Emulsion, suspension.
Emulsion and suspension. Very good. So most of the pediatric dosage are available in suspensions. Okay. Either it can be a dry one or it may be a packed or wet formulation. There are two types of suspension. One is dry suspension, other one is wet. In dry, you have to make up the suspension by adding the hot and cold water. Like you have to boil the water, cool it, and you have to add into that in the warm condition shaking. And the prepared suspension should be used within 3 weeks. So when you are preparing a dry suspension, you are taking, for example, you are taking a metronidazole for amoebic and amoebic dysentery. This you have to use within 3 days. What is the condition means? 3 days you have to complete it. You should not store it for a long time. What is monophasic?
Internal and external, internal shots,
Elixirs, inhalers.
external spray,
Sprays are there. So you can know that sprays, you are going for sports and all. Yeah.
liquids,
Gargles, where you use gargles? Mouth. Okay.
mouthwash, nasal drops, throat pain, eye lotion, lotions.
What is the use of mouthwashes? Why we are doing for mouthwashes? Cleansing property, very good.
Semi-solid dosage form, internal and external facilities. Suppose it is external ointment, jellies, paste, creams.
Okay. Okay. You also summarize this. Next. Yeah. So we have seen so far what are the things? Pharmaceutical dosage form. So you have in your semester you have emulsion and suspension. Isn't it? The biphase. So what are the preparations you over so far? Your emulsion and suspension. How will you prepare an emulsion? We'll take a Martin crystal. What will you take? Emulsion. How will you prepare emulsion? The rotation of the particles should be done in a similar way. Isn't it? If we rotate, Martin crystal thing that it is still funding like you shake it and get it. They are doing an emulsion and suspension. Okay? So the pharmaceutical dosage forms, if you compare this or me, now we have in parenterals, we have many applications. So at least you as a second year, second and third sem students, emulsion and suspensions, which you have some examples, you have to be very clear.